Seems like we constantly hear one of the defenses for Obamacare that it's working so well in Massachusetts. And there are some who say that is a good argument on their behalf, and then there are others who say it's really an argument that we ought to let the states have it and not have it centralized in Washington. What are your thoughts when that argument comes up?
No, I let you go.
Well, I mean, I'll take it from one perspective, and Christy probably has a different. I thought that her summary of the research was great, and that research is many times mischaracterized about how expansion works, and I think that she broke it apart really well. But I mean, the reality is Massachusetts is a wealthy state, and its healthcare providers are the most powerful political lobby in Massachusetts. So it's not a surprise that they expanded. Massachusetts is 97% insured because they're wealthy. They're not wealthy because they're 97% insured. And so when we think about the progression that every state is on the economic continuum, Massachusetts has one of the highest per capita incomes in the country. It has one of the highest number of PhDs and college graduates in the country. It's a completely, when I talk about the social determinants of health, their economy is there where their high income, their high education is driving the good health of their population. And Medicaid expansion was really just a financing mechanisms to get more money into the very large health systems and academic health systems out there. It wasn't about poor people. And actually, if you look at, there's a lot of interesting statistics about a lot of interesting disparity statistics about taking a look at the bottom 20% income-wise health and the upper 20% income-wise health. And if you look at states like Massachusetts, their poor are actually doing much worse off than a lot of southern states' poor. And so they have the reason why their overall health statistics look better is because they have a lot fewer poor people. But they don't do any better job taking care of their poor people than Alabama or Louisiana or South Carolina or everybody else. And actually, if you look at a lot of these disparity statistics, they do a worse job at it. So I think folks who point to Massachusetts don't really understand what the purpose of, what they were trying to accomplish in Massachusetts. They weren't trying to help out poor people in Massachusetts. They were trying to round out some of their financing problems that their large academic institutions had. And they have not shown, as Christy displayed in a lot of those statistics she showed, expansion, including in Massachusetts, has not shown improved health for those populations.